Chapter 10, Questions Without Answers. There is no human life not worth living. Albert Schweitzer. The child was lying naked on a bench, abandoned by its parents at one of the clinics. As I glanced at him, green diarrhea jetted out of his rectum. His deeply sunken eyes, tearless cry, and parched mouth confirmed his dehydrated state. Although only 1 year old, he was going to die unless he was taken to the children's home. When I looked at his eyes, I was horrified to find that both his pupils were white instead of black. He had cataracts. In an adult, the removal of a cataract restores vision, but this child had congenital cataracts. Contrary to popular belief, one does not see with the eyes but with the brain, the eyes merely acting as cameras to transmit the image. If the brain does not learn to see while it is developing during infancy, it never learns to see. Therefore, this child would remain blind, even if the cataracts were removed. What would he do in Haiti? The sisters brought him to the children's home. I rehydrated him intravenously, and within 2 days the diarrhea stopped. He ate like a little pig and soon appeared healthy, except that he had the annoying habits of banging his head against the side rails, smashing his face with his hands, and rolling face down on his bed. This bizarre behavior was self-stimulation that compensated for his blindness. Before coming to Haiti, I spoke with a prosperous physician 40 years my senior. I told him all my ambitious plans: saving dehydrated babies, starting a vaccination program, setting up a laboratory, saving lives, the supposed goal of medicine. He looked at me with the omniscient condescension that typifies the relationship between older and younger physicians and remarked, "You will destroy the ecological balance." When he saw the shocked look on my face, he felt bad and retreated from his visceral reply, wishing me luck and asking what he could do to help. After curing this patient, I realized that he had a point. Medically, I had cured this child, but did I have access to the resources to rehabilitate him, teach him Braille, educate him, teach him a marketable trade, and finally find him a job? Of course not. I just got him better. Perhaps the sisters could find some benevolent organization to care for him. But what if they did not? Would he end up begging on the street like so many others until he died of starvation or illness? Did I do him a favor? Is Albert Schweitzer right? If I decided to save his life, did I have the responsibility to arrange his care for the next 70 years? If I were unable to assume this responsibility, should I have allowed nature to take its course, select out the weak, and preserve the ecological balance? Perhaps his case would not have caused me so much consternation if I had not just met Pierre, a new patient at Saint-Fille. At a young age, Pierre was crippled by a rare complication of tuberculosis that collapsed his vertebrae, thus damaging his spinal cord. His mother, unable to care for him, gave him to a missionary group that washed him, fed him, taught him English, and converted him to Christianity. Unfortunately for Pierre, this group decided to spread the Lord's word in another country, leaving him homeless. A relative tried to care for him but could not, so Pierre ended up lying on the street for several months until a priest found him and brought him to Saint-Fille. When he first arrived, he was covered with flies that were feasting on the multiple skin erosions caused by 2 months of immobilization. His legs and arms were frozen at 90-degree angles, his muscles having contracted from disuse. His deformed back arched into a huge dowager hump, its apex being at the same level as his earlobes. He smiled as I examined him, but was too weak to speak. It was this image I recalled while saving the blind infant. Day and Nick recognized his strong will to live and went to work, rehydrating him, debridling his skin ulcers, and exercising his limbs. His legs did not fully recover, but his arms did, so that after a month Pierre was sitting in a wheelchair dispensing advice to anyone who would listen. The sage of Saint-Fille. Pierre enjoyed imitating my speaking Creole. Like most Haitians, he found it amusing, not only because of my heavy accent, but because I spoke like a peasant. Upper-class Haitians speak Creole interwoven with the euphonious glissandos of French, but the peasants speak the same language with a guttural twang. Having never studied French, and with Haitian peasants as my teachers, I spoke it the same way. It was as if a European learned English while working in an American ghetto and consequently spoke jive. Americans would find it funny. Pierre was not only a gifted mimic, but also a talented artist, and the drawings he gave me are among my personal treasures. His command of English and repertoire of hymns made him popular with the visitors. He showed me what untapped ability existed in the poorest of the poor, even the handicapped, if they were only given a chance. Perhaps the blind baby would prove to have hidden talents also, but the thought of that poor child ending up as Pierre did when I first saw him made me shudder. I knew that chances were that there would be no angel in white to help. I convinced myself I had done the right thing in saving the blind baby, but if someone had told me he was better off dead, I would have disagreed, but not vehemently. The most agonizing decisions was whether to treat those who were brain damaged by meningitis. It was a disease I could not miss because the stakes were so high. It could be fatal, but even worse, it could cause irreversible brain damage, condemning a child to grovel on the streets until death came. Classically, these children had a piercing, high-pitched cry, a bulging fontanelle, fevers, and no appetite. Unfortunately, meningitis usually presented with much subtler symptoms such as lethargy or persistent crying. I did at least 2 spinal taps daily and was constantly amazed at how subtle the symptoms of meningitis could be. Although diagnosing a case of meningitis early was satisfying, it was more the exception than the norm. Many of the cases I saw were like Louis. I first saw Louis at a clinic where his perplexed mother told me, "Il pas qu'à parler," he can't speak. Louis looked about 4 years old, and even the developmentally delayed Haitian children speak by this age. It made no sense to me until I looked carefully at his face. When Louis stared at me, the eyebrow above one eye furrowed while the other remained motionless. One half of his face was completely lifeless, so that attempts to smile or cry resulted in macabre, half-face expressions. When I examined him further, I discovered he could not move one side of his body. I had seen this in the United States many times, but only in the elderly. Louis had suffered a stroke. Suspecting meningitis, I took him to the children's home and confirmed my diagnosis with a spinal tap. With intravenous antibiotics, the meningitis cleared, but the stroke did not. Because he could pathetically move only one side of his body, he could no longer walk, and when he tried to speak, an incoherent gibberish came out. The stroke had destroyed the speech center of his brain, thus explaining the mother's original complaint. The sisters offered to care for him, but the mother insisted on taking him back. He had absolutely no chance of surviving with even a minimum of dignity. I had encountered this scenario several times. I cured a brain-damaged infant from meningitis, but the neurological deficits persisted. Instead of these children dying, they were being returned to their families paralyzed, retarded, and unable to communicate. Was I doing these children a favor? It was obvious that I was not. Supposedly, the neurological deficits of meningitis resolve when the disease is cured, but I never saw this happen. Eventually, I stopped antibiotics on any child with meningitis who had brain damage, effectively allowing him to die. I do not know if it was the right decision, but it is the one I made. It was classic situation ethics. In the United States, where there were programs for rehabilitation and special education, it would have been wrong to withhold treatment. In Haiti, it was a different situation. It might not have even been wrong in the United States, but many who tried to help Haiti concluded that the only way to help a handicapped Haitian was to get him out of the country. I was no exception, but as I was to find out, this often did more harm than good. At Sanfi, there were 2 prime candidates, Mario, who had a heart defect, and Antoine, who had an unhealable leg ulcer. Mario's heart failure was so severe that it resulted in massive total body swelling so that his legs looked like tree trunks, his abdomen like a watermelon, and his face like a full moon. Even more striking than his appearance was the constant whoosh, whoosh, whoosh emanating from his chest. He had a heart murmur so loud that I could hear it while standing at his bedside. I placed my hand in his chest and felt the murmur reverberate through my bones from his breastbone to the side of his rib cage. I listened to his chest with my stethoscope, hearing a heart murmur that was literally deafening. Mario had either a defective heart valve or a hole in one of the walls that separates the heart's chambers. I did not know which it was, but I did know this: there was nothing I could do about it. He required heart surgery. I had Day and Nick give him digoxin and Lasix, which allowed him to breathe more easily. However, he slowly worsened to the point where it required a Herculean effort on his part just to walk to the bathroom. I reconciled in my mind that my job was to keep him comfortable during his stay of execution. The other was Antoine, a handsome, charming, and somewhat manipulative young man with a huge leg ulcer that refused to heal. We cleaned it, debrided it, dressed it, gave him sundry antibiotics, and accomplished nothing. Antoine needed a skin graft, a procedure I had neither the expertise nor the equipment to perform. Without one, Antoine would eventually need to have his leg amputated. Along came American technology in the form of a visiting doctor from a prestigious hospital. He examined Mario and Antoine and decided to arrange proper medical care for them in the United States. Day went to work pulling the proper strings in the Haitian bureaucracy. He had to physically carry Mario to a police station to get him fingerprinted. It took him a month of forging birth certificates, paying bribes, and taking pictures, and culminated in his posing as an American doctor in the office of the Director General, an equivalent to a cabinet post in the United States. It paid off. Day obtained passports and visas for both Mario and Antoine. The three of them, along with Nick, left for the United States, the last frontier for the Haitians. Mario, his face more swollen than ever, smiled and waved a Haitian flag as I watched him being wheeled onto the airplane. The American doctors were impressed that we had kept Mario alive. Even his blood digoxin level was the proper concentration. They performed a cardiac catheterization, a procedure in which dye is injected into the heart and x-rays are taken. It showed that Mario had a defective pulmonary valve. Mario, who 1 week ago had lived in a country where most medical problems are handled by Ungans prescribing herbs, was wheeled into a sterile operating suite where the best and brightest placed him in the proper plane of anesthesia and cut open his chest. His heart was dramatically stopped, and he was placed on one of the triumphs of medical technology, the heart-lung machine, which kept him alive while his pulmonary valve was replaced. Mario would have been better off with an Ungan. His heart was too weak from its long fight to keep him alive. Its muscle fibers stretched beyond the point where they could muster a decent contraction. Merely replacing the valve could not change this. His lungs filled with fluid, and Mario found himself with a tube jammed down his throat while a machine breathed for him, wondering what he had done to offend God to deserve this. Mario languished in the cardiac intensive care unit for a week with tubes in every orifice and needles in his arteries and veins. Finally, he died the American way, in a blaze of glory, with interns dramatically pounding his chest and shocking his heart while pushing a potpourri of drugs into his blood vessels. Antoine, with his healing leg, attended his funeral. Upon hearing about Mario's death, I consoled myself in the knowledge that Antoine was cured and now had a chance in the industrialized world. Alas, poor Antoine had no more chance of adapting to the Midwest than a Midwesterner who found himself alone in rural Haiti. No one knew his language, and no one understood his culture. He became disgusted and depressed and returned to Haiti, but at least with 2 good legs. These attempts to help represented the ultimate in frustration. After $100,000 in medical care, which would be very much more than that now, Mario was dead, and Antoine was once again in the environment that spawned his initial state. Again, I tried to console myself by thinking we at least gave publicity to the plight of Haiti, but deep down I felt it was a colossal waste. It represented a sensationalist approach to a difficult problem. How many vaccinations could have been given with that money? How many could have been educated? Those who brought high-tech American medicine to Haiti caused problems too. Frequently I saw cases where surgery did not help the patient. One middle-aged woman came to the clinic complaining of faiblesse or weakness. This is the most common complaint and is usually due to malnutrition. She cheerfully answered my questions, telling me she had been selling fruit at one of the local markets, but in the past month had to stop because she was constantly tired. A drab blue plaid dress hung from her feeble frame, and a multicolored handkerchief covered her head. Her most striking feature, though, was her bulging eyes unintentionally staring at me, a classic presentation of hyperthyroidism. The thyroid's the gland located in the neck, in front of the trachea or windpipe. It secretes hormones, chemical messengers that regulate the body's metabolism. Too much thyroid hormone increases the metabolic rate so that the hyperthyroid patients become overactive, nervous, and irritable. They sweat constantly, which makes their skin moist, and they have high blood pressure. Their reflexes become so active that a doctor checking them can accidentally get kicked in the groin. Frequently, collagen is deposited behind the eyes, causing them to bulge, making them appear like they are constantly staring. Her problem did not make sense to me because hyperthyroid patients rarely complain of weakness. If anything, they complain of having too much energy. The situation became more puzzling when I examined her. Her skin was extremely dry. Her blood pressure was low. When I tapped under her kneecaps with my hammer, she barely had any reflexes. This seemingly contradictory presentation was explained by a 3-inch circumferential scar stretched across the front of her neck. With the exception of the bulging eyes, she had all the symptoms of hypothyroidism. "Did you have an operation there?" I asked in Creole. "Yes," she replied, "about a year ago." "Why did they operate?" I continued. She did not know, telling me that an American surgeon had operated on her at a local mission hospital. Apparently, the surgeon had partially removed her thyroid gland, making her hypothyroid. Since the collagen behind her eyes did not regress, they still bulged. If she had been in the United States, there would have been no problem. The blood level of the thyroid hormones would have been monitored periodically. If they became too low, the hormone would have been replaced orally. In Haiti, it's not that easy. This poor woman had no idea what her problem was. If she did have follow-up, she chose to ignore it, perhaps not comprehending the directions given to her. I had no thyroid medicine and was unable to help her. All surgeons know that performing an operation properly is only half the battle. Meticulous postoperative care is also necessary. Failure to do so can ruin everything. Nowhere is this more evident than in eye surgery. Several organizations bring sophisticated equipment such as expensive operating microscopes with the noblest of intentions to make the blind see. One university even sends trained physicians to learn how to remove cataracts and perform corneal transplants. Patients who had eye surgery often came to me for other medical reasons. I noticed that the surgery performed was technically good, but there was one problem. The patient could not see. A cataract is a lens that opacifies, blocking vision. The lens is located behind the iris, the colored part of the eye that encircles the pupil. It bends light rays so that they focus clearly on the back of the eye or retina. The lens may become a cataract for many reasons, such as diabetes, trauma, or simply old age. When it does, there is only one treatment: removal. Primitive societies used to stick thorns into the eye, pushing the cataract out of the line of vision. Unfortunately, the ensuing infection destroyed the entire eye. With modern surgical techniques, a cataract can be removed safely. However, there's nothing to bend the light rays in the eye so that they focus clearly on the retina. More than an operation is needed. The eye must be watched for complications, and after the incisions have healed, the proper glasses must be prescribed to compensate for the absent lens. Rarely does this happen in Haiti. Even if patients manage to get the proper glasses, they do not wear them for long. Glasses are a sign of education and prestige to up-and-coming Haitians. A patient with cataract glasses will sell them, opting to see a bowl of food out of focus rather than an empty bowl clearly. One young man came to my clinic wearing cataract glasses. They are easily identifiable because they are thick and look like miniature magnifying glasses. Since he had never had eye surgery, there was no way he could possibly see with them. I confronted him with this fact, but he denied it. Holding up my watch, I asked, "Qu'il est lié? What time is it?" Grudgingly, he took off his glasses so he could tell me. After I treated his problem, which was a rash, he smiled, thanked me, put on his glasses, and left. Giving the facade of education was more important to him than seeing. Even when we arranged for babies to be adopted overseas, I wondered if we were doing the right thing. A couple I knew, both doctors from Holland, were caring for a sick, malnourished Haitian child in their apartment. As he regained his health, it became apparent that returning T. Joseph to his mother would result in his death, as she had no husband or source of income. The mother was willing to allow Francis and Anne to adopt T. Joseph, but for a price, $100. Francis and Anne brooded over this dilemma for weeks. $100 was a pittance for adding a new life to their family, but they had a philosophical objection to paying the woman, arguing that it would encourage poor Haitians to generate babies for selling. They also wondered about the psychological effect this would have on T. Joseph when he approached the age of reason and learned the circumstances of his adoption. Well, they shouldn't have worried about that, because that's not a problem. Francis was not concerned about raising a black child in Holland, proudly recounting the long history of Dutch tolerance to those different from themselves. An incident solved their dilemma. During the day, Francis and Anne worked, so they hired a Haitian nanny for T. Joseph. One day upon returning, they overheard this woman teaching T. Joseph his first words. She did not want them to be mama or papa, but give me dollar. T. Joseph's mother was soon $100 richer. I was involved in a similar situation myself. The sisters had found a woman in the depot who was almost dead from malnutrition and dehydration and nursed her back to health. As she improved, it became apparent she was pregnant. I personally saw to it that she got good prenatal care, giving her vitamins and frequent examinations. Elizabeth was born at 2 in the morning, but since the phones were not working, the sisters could not contact me to deliver her. The next day at Saint-Fie, I met this beautiful, healthy baby girl. 2 weeks later, she was baptized, and I was her parrain, godfather. I saw to it that Elizabeth got the same health care as a yuppie puppy in Manhattan. Minor colds were attacked as if they were life-threatening illnesses, and the proper vaccines were administered religiously. I insisted that the mother breastfeed her and urged everyone to play with her so that she received proper stimulation. She was gorgeous and looked like a typical healthy American baby, although the Haitian women told me she was gâte, spoiled. I loved this child almost as if she were my own, and when I realized she would die within weeks after the mother left Saint-Fie, I had the same reaction as Francis and Anne. I urged the mother to give Elizabeth to the sisters for adoption. I wondered whether I had the right to do this, but I did it anyway. Working in Haiti was depressing, and I needed some positive reinforcement. I was not about to witness the death of a child whom I had been caring for before she was even born. The mother, with some coaxing, agreed, and the sisters found the child a home in Belgium. The mother quietly sobbed as the only thing in her life that she loved left her. I am not sure Elizabeth will appreciate what was done for her when she is 18. She may long to find her mother, and this will be difficult, although not impossible, since I have pictures of her. On the other hand, she now has the opportunity to grow up in the industrialized world, get an education, and have the luxury of searching for her roots if she so chooses. Perhaps she will decide to help Haiti. However, someday she will read these pages and ask me what gave us the right to take her from her home, and I do not know what I will say. One of the worst aspects of working in Haiti was that I had no backup, unleashing a variety of dilemmas. Frequently, a dying patient arrived when I was ready to quit for the day. One Friday evening, after an exhausting week, I was looking forward to meeting some friends at one of the local watering holes. Just as I was walking out of the children's home, a woman came towards me. I pretended not to see her and kept walking towards my moped. Undaunted, she held her baby in front of my face and said, "Doctor, li pas vle manger." Doctor, she won't eat. When I looked at the child, it was obvious why. She was dehydrated and dying. Earlier in the day, my reaction would have been of compassion, but now it was restrained outrage. Why did she have to come now? I can't save every baby in this wretched country. The mother had no job, no husband, no source of income, and was pregnant besides. Even if I saved this baby, she would probably die later. It was the same reaction I had during my internship when a new patient came when I was ready to go home. The big difference was that during my internship, there was always backup, always someone who could do what I could not. Here, there was none. If I jumped on my moped and took off, this child would die. Even though my emotions were irrational, my actions were not. I had only one choice, and that was to bring the child into the children's home and save her. To my surprise, she had a large vein in her hand. In my haste, I perforated it, forming a large hematoma, and therefore had to spend the next half hour finding another vein. When the intravenous line was finally running, I stayed another hour to make sure that the child improved without being overhydrated. The next day, the child was sitting up chewing on a piece of bread and eyeing me suspiciously. The mother, beaming, offered to give her to me. There were other times, though, when my neglect and fatigue caused a child's death. I had seen Jean in the children's home one morning, and since he was only mildly dehydrated, I opted to rehydrate him with a nasogastric tube. I told the sisters I would check on him in the afternoon. Sanfi was busy that day, and when I was finally done, I realized I was late for a dinner invitation. As I was driving up Rue Delmas, I was debating in my mind whether to check on Jean. I was in the left-hand lane to make the turn to the children's home when I said to myself, "He'll be all right." He wasn't too dehydrated and surely responded to the oral rehydration. Anyway, the sisters can start an intravenous line if he needs it. I can't be on call 24 hours a day, 7 days a week. I veered into the right lane and continued to Pétionville. This rationalization cost Jean his life. With considerable trepidation, I walked into the children's home the next day and immediately headed for Jean. His eyeballs were sunk deep into his skull, and his skin tented when I pinched it. His eyes gazed in different directions, and when I rubbed my knuckles on his chest, he did not object. The sisters told me he had vomited the fluid and that they could not find a vein to place an intravenous line. Feeling guilty and remiss, I quickly placed an intravenous line in his scalp and soon had normal saline rushing in. I followed it with ampules of bicarbonate and epinephrine, but it was hopeless. He was too far gone. The fluid continued to pour into his lifeless body until I faced reality and discontinued it. Because I had gone to dinner, this child died. For the next week, I worked feverishly and compulsively to make up for my error, but I gradually realized that I could not do everything and save everyone. Furthermore, I should not feel guilty about it. Throughout my stay in Haiti, people died because I could not work 24 hours a day. It was just something I had to get used to, the reality of being a physician in Haiti. Often I had to decide whether to continue treatment or allow someone to die. In the United States, this decision is diffused amongst other doctors, family, and clergy. In Haiti, I had to make it myself. I had to play God. Day was vigorously sawing the cast off the leg of a young man who had just arrived at Sanfi. 6 weeks previously, a car had crashed into him, breaking his femur. The driver just kept going. He had no worry over legal responsibility. He simply saw no sense in helping a stupid peasant who was in his way. Eventually, the injured man had been taken to the general hospital. Since Day did not have a cast cutter, he had to use an ancient saw, placing a piece of wood under the cast to prevent cutting the patient. After a half hour, the cast was off. It was, as he expected, a disaster. 3 inches above the knee, the femur was protruding through the skin. The bone had never been set, just pushed back through the skin and covered with a cast. When the patient did not improve, he was heaved into the depot. There he lay for several days, getting an occasional bowl of rice until the sisters found him and brought him to Sanfi. Day asked me to examine him. I had seen many depot patients before, so nothing surprised me. I walked to the bedside and gazed at a fading human being. Hundreds of large black flies hovered above him, attracted by the excrement he had just deposited on the anticipatory vinyl sheet under him. He preferred to lie on his side, which stabilized his exquisitely painful leg. Bed sores on his ankles and buttocks testified to his recumbent position for the past 6 weeks. The sisters had cut his hair as it was infested with lice and scabies. I asked him what had happened. He babbled incoherently since he was delirious with fever. Protruding from his thigh was his fractured femur. It was a clean break, and I could clearly demarcate the white outer cortex from the red, highly vascular middle. A pungent white frothy pus surrounded the bone. Day pressed on the skin above the bone, squeezing out more pus along with feasting maggots. He looked like a refugee from Dachau. The next time a patient in the United States complains to me about the bland hospital food or the lackluster quality of the television picture, I will mention the state of this unfortunate man. I gazed at him a little longer, then glanced at Day. I said nothing, but Day could read my face. I walked away. A group of idealistic college students was following me. Perceiving my inaction as apathy, they challenged me to save him. One of them suggested that I reset the bone. This was obviously ridiculous. A broken femur, even in the hands of a skilled orthopedic surgeon, is difficult to reset and must be rejoined by metal plates. I had neither the skill nor the equipment to perform this sophisticated carpentry. Furthermore, if the femur has an infection, it must be eradicated first before any attempt is made to repair him. Day gave him antibiotics, but both of us knew the only way to save him was to amputate the leg. I saw no sense in this. The man had lost his will to live. There is a Haitian proverb that goes, "Si vous voyez monsieur aller sur le pral mourir vrai." If you see a man soil himself, he will surely die. This wisdom, well known to illiterate Haitian peasants, has not percolated up to the American medical establishment. Huge sums are routinely spent on patients trying to die peacefully. After years of practicing medicine, most doctors become less aggressive. In Haiti, it took only several months for me to reach this stage. I was no longer the green compulsive intern charging windmills. My medical judgment had aged rapidly. My intervention could not help this man, and to amputate his leg would be an act of macho barbarism. Day saw to it that he drank well and controlled his pain with generous doses of Demerol, a narcotic. Day tried to feed the poor man, but he had no appetite. After a week, he died peacefully. In Haiti, our job was not only to cure, but to comfort. But sometimes, even deciding whether to comfort a patient was difficult. One young man who had come to Saint-Fith had a weak smile on his face, the look of someone who had suffered immeasurably and was relieved that he was finally going to die. "Map more, I'm dying," he said between breaths that I timed to be 80 a minute, incompatible with life. His cyanotic lips formed a macabre contrast with his black face. He sat in a green scrub suit, his sweaty palms firmly grasping his knees to stabilize his shoulder girdle. This provided a firm base so the muscles attached to his clavicles could elevate the ribs and aid his labored breathing. His lips were puckered to increase the oxygen pressure in his lungs, and where he inhaled, the force was so great it sucked in the skin between his ribs. He had every symptom of respiratory distress listed in the medical textbooks. In an American hospital, he would have been intubated and placed on a respirator, stat. I listened to his lungs, hoping I would hear something I could treat, the dissonant rails of heart failure which I could eliminate with a diuretic, or the silence of a pleural effusion which I could clear with a thoracentesis. But all I heard was wheezing, the sound made as air whistles and swirls in the huge cavities of vacated lung tissue consumed by end-stage tuberculosis. He read my face, concluded I could not help him, and reaffirmed with a weak smile, "Map mourir." I began anti-tuberculosis drugs and antibiotics, but I did not know how to comfort him. No oxygen was available, and I was afraid to administer Demerol or Valium because it might decrease his respiratory drive. It was a terrible dilemma. Should I give him medicine for the comfort that could lead to his demise, or allow him to suffer on the slim hope he would recover? I opted not to give him these medicines. It was the wrong choice. He died the same day after several more hours of agony. While working in Haiti taught me a much simpler method of practicing medicine, the ethical complexities were just as difficult as in the United States, where physicians have to deal with decisions on when to discontinue respirators, on brain-dead patients, and the management of brain-damaged infants who have come out of the womb 3 months too early. In Haiti, the situation was complicated by a lack of support structures. At least in the United States, a handicapped individual could be institutionalized and assured of being fed, clothed, and cleaned. In Haiti, this was rare, even for the healthy. Consequently, what would be considered appropriate treatment in the United States was senseless in Haiti.